to talk about the anatomy here a little bit. The most important thing you're doing when you do this procedure, and everybody really gather around so you can see this, is you want to find the thyroid cartilage, right? That's the big Adam's apple on men, or sometimes women, it doesn't matter. But you want to find that. You can usually find that pretty easy. The one thing you don't want to get confused with, it's a little higher up here, is the hyoid bone. It's actually a bone that's up here higher. Sometimes people feel that. It's like, oh, I found something that's hard. That must be what I need to make my incision down there. That's too high. You want to find the thyroid cartilage. And on most people, it's pretty mobile. This guy's relatively thin. We can actually see it. You get a larger patient, it might be a little bit more difficult. But grab it, and I usually grab it with my non-dominant hand, because the procedure you're going to want to do with your dominant hand, right? You want to cut with your dominant hand. So I find that, I grab it, and then it's just kind of a shield-shaped cartilage, and I work my way down with one of my fingers. Then I want to find there's almost a little space in between down there, right below. That's going to be the cricothyroid membrane. And immediately below that is the cricoid cartilage. So in between the thyroid cartilage and the cricoid cartilage, you have the cricothyroid membrane. That is our target. That's what we're going for. Now, if I make an incision that ends up going a little too low, it's okay. It'll still go in the trachea. You'll be fine. You'll essentially have a trach. Not a big deal. Where you don't want to make your incision is too high. The thyroid cartilage, it's really tough. And once I dissect some of this down, you'll be able to see it real well. It would be very hard to cut through that. But the problem is if you cut through that, and it's tough for a reason, is your vocal cords are right behind that. So they're protected by that, and it makes sense. You don't want to cut into that. That would make a mess and cause problems. You want to stay below that. So you want to stay below the thyroid cartilage. So this is all anatomy, and this is all a midline procedure. You want to stay as much on the midline as possible and stay away from out here, because what lives out here, all your blood vessels and things, right? Carotid, jugulars, big blood vessels that are going to your head. You want to stay away from that. So the more you make this a midline procedure, the safer you're going to stay. There are some small veins that run in here, and there's a couple small arteries. It's okay if you hit those when you're doing this. It's going to bleed. It's okay. That's to be expected a lot of times. So again, want to find that cartilage. Want to hold it. I usually grab it with my fingers so that I know in case things are moving around with my non-dominant hand. And again, I feel with that finger. Now, there are two different ways you can do this incision-wise. If you're very confident and you have a thin patient like this, you can just do a completely horizontal incision through the membrane. And if you're not 100% sure, and the way that I actually recommend to do this is make a vertical incision longer than you need, and it gets you down a little bit, especially if you have a larger patient. Find that cricothyroid membrane for sure, and then make a horizontal incision, and that's the way I'm going to show you. And then basically what you're going to do is you can put your finger in the hole afterwards, followed by the bougie, and then you're going to use the bougie the same way you're used to using the bougie. Put it in there. A lot of times you actually can feel the rings, and it's going to hang up, and it's going to hang up a lot quicker than it would if you're coming in up through the mouth and trying to do the intubation. And then, of course, your tube on. And again, 6'5", 6'0" is a good size to go with. And you just need to put it in far enough that the cuff goes through the hole. You don't need to go farther than that. It's a lot easier to right main stem, which is not the end of the world, right? You can always pull it back if that's the case, but it's going to be a lot shorter distance than it would be as if you came in from the mouth. So we'll go ahead and walk through the whole thing here with the incisions and all. So I'm going to do the vertical and then the horizontal because I think that's the safest way to go. So I'm going to start up here. I'm going to cut above the thyroid cartilage. I'm staying in the midline. I'm going down, just about there, generous incision. You can see fat. And what I'm doing now is I'm going to repalpate. Got my thyroid cartilage again, cricoid down there. Cricothyroid membrane is essentially right down here below. And then I'm going to cut, and I can feel that I've cut into a space. I can put my finger in there, or I can put the bougie directly in there. Now I've got hang up right there. One thing you don't want to do is, a lot of people don't cut deep enough. They make a false passage in the skin, and then it stays in the skin. Because most people are afraid to cut because the scalpel blade is not something you're using every day. So they're afraid to cut, so they make these little tiny incisions. They don't go deep enough. Most people aren't going that deep that they're going all the way into the esophagus. That's actually fairly rare. And then I want to follow this up with my ET tube. Sometimes you have to give it a little twist, just through, and then bougie comes out just like it normally would.